Hey friends, I'm Dr. Molly Brinkman. I'm a small animal veterinarian near Nashville, Tennessee. I love pets. I'm actually probably obsessed with your pets, and I love to educate pet parents, and that's what this podcast is for. Welcome to the Dr. Molly Says podcast. Okay, today we have a very special guest, and this is Dr. Ben Bergstrom. Hi, Ben.
Thank you so much for having me on, Dr. Molly.
We're very excited to have you. Ben is a friend of mine. So Ben and I met, when did we? Ben is an ophthalmologist. That's why Ben's here. And he practices here in Nashville. We're going to get into how all that came to be. And so I guess that's why we know each other, because I'm a GP here. And so I refer patients to Ben. And Ben is from Illinois.
That's correct.
Rockton,
Illinois, right up on the Wisconsin-Illinois state line.
Okay.
Almost the last town before you enter into Wisconsin.
And it's like small town. Rural.
Yeah.
Okay, cool. So you grew up there, and then you went to undergrad in Illinois.
That's correct.
Urbana-Champaign.
University of Illinois. Go Illini.
Yes. And then you went to vet school, and you did an internship at Georgia, rotating small animal internship.
Yep. Go Bulldogs.
Okay. I don't know how I feel about that. Go Balls. But okay, great. So you did an internship, and then you went back to the Midwest and did your ophthalmology residency at Purdue.
That's correct. And one more time, go Boilermakers.
Okay, it's a lot of goes.
It's a lot.
Okay, so Purdue finished in 2017, and you came straight to Nashville after your residency.
I did.
And tell me what you did. Tell us what you did first in Nashville, because it's interesting.
Yes. So my wife and I decided to move to Nashville because she's actually a poultry nutritionist. So we needed to end up in the Southeast, and it worked out that there was another practice in town that was hiring, and I was fortunate enough to be hired at the practice in private practice for 6 years, and then had the opportunity to step out on my own and started a private ophthalmology practice here in Nashville.
Which I'm very thankful for, because I send lots of my patients to you now. Yes, that is... I'm excited to get into that, talk about all of it. So yeah, that's your job. And you mentioned your wife, Tara. Mm-hmm. Does she still do poultry nutrition? I didn't actually know this.
She does,
okay.
Yeah. So she's still a poultry nutritionist. I'm very proud of her. She was the top sales producer for her company this year. And she wears many hats like
you do. Awesome interior designer kind of stuff.
Yes. But we're very happy here in Nashville. We now have a 3-year-old little girl named Stella.
She's so cute.
And
she just turned 3, right?
She just turned 3. We just did Disney for the first time.
So fun.
Yeah. So enjoying Nashville.
And you have pets. You have to tell us about your pets.
We have this weird obsession with color palettes, and we've stuck to a color palette. So black and white animals has been the theme throughout for Tara and I. So we first had Agnes, who was a black and white pit mix. We sadly lost her last year. But we also have Henry, who's a domestic short hair, black and white tuxedo. And we have Opal, we call her Opie, who has one eye, fitting, also black and white. And our newest addition is Olive, who just turned 1.
What is Olive?
Olive is also a pit mix.
A pitty mix.
Yes.
Oh, I don't think I've met her.
Mm-hmm.
They're all so cute. Okay, so 3 pets and a 3-year-old human in your house right now.
That's correct.
That's a lot. Okay, and Dr. Bergstrom launched the iVets, which is his privately owned specialty ophthalmology practice. And the main location is in Bellevue, which is about 25 minutes from Beecham Animal Hospital where I practice. But it's very great location near Nashville, but also near other surrounding areas. And there are other locations, yes?
So we have a main location that you just described in Bellevue, and then we have satellite locations. The objective with the satellite locations was just to expand our reach.
Yeah.
I'm really passionate about getting the word out about veterinary ophthalmology and making it available to as many people as possible.
Yeah.
And so the satellite locations, we pay a daily rate. We use other facilities, and we travel to Goodlettsville, Tennessee, Spring Hill, Tennessee, Clarksville, Tennessee, and Bowling Green, Kentucky.
Yeah. And it's quite that's people that don't live here don't know what that means, but it's it's a large range. That's a lot of places. So.
It is. Yeah.
What's the furthest of that? It's like 2-3 hours, 2 hours?
The furthest right now would be Bowling Green, and it's only about an hour.
Oh, it's only an hour. Oh, yeah. I thought it was further than that. Yeah. Okay. Well, still, yeah. Okay. So many people have more access to ophthalmology for their pets, which we're going to talk about what that actually means. So I'm so excited about this episode because one of my goals with doing the podcast was I want pet owners to know about all of the veterinary specialties. You and I were just talking about the episode, and I was saying that I still talk to owners in exam rooms, and we're talking about options for next steps, diagnostics, workup, treatment. And I'll say, I can refer you to a veterinary ophthalmologist. I can refer you to a dermatologist. And I still have people be like, wait, that's a thing? Yeah. I had no idea. And so I also am passionate about people knowing about it because, and this is something we're going to talk about later, but we both feel very strongly that GPs and specialties should be able to work together to get pets the best care. And so I want you all to know that you should be able to find an ophthalmologist where you live, and your GP can send you there. So I want to talk about how that happens, but first, I was going to see if you have a hot take ready to talk to people about.
Hot take on veterinary ophthalmology?
I think you should definitely do a hot take about veterinary ophthalmology.
I think the most important thing is if you feel like something is wrong with your pet's eye, whether it's red, it's cloudy, it looks painful. And one of the most common misconceptions is pain in a dog. This is pain.
Yeah.
Dogs don't do a lot for us to give us an understanding of what's going on or if they're painful. But if you see any of those things, don't wait.
Yeah.
Eyes go bad. They go from 0 to 60 very, very quickly. And so reach out to your primary care provider or reach out to a specialist that's close to you and ask if you need to be seen.
Yeah. I have always told my clients, eyes are an emergency until proven otherwise.
That's right.
So yeah, it's a hot take. It shouldn't be a hot take, but it kind of is because people will wait. Their dog's eye starts squinting or it's red or they've got discharge on Friday and they're like, oh, I'm busy. I'll call the vet on Monday. And those 3 days can be the difference in keeping an eye or not. So, and you know that more than anybody. Yeah. So it's a really important message. And it's great. Okay, so let's talk about a veterinary ophthalmologist. So this is a boarded veterinary specialty, which means just like all veterinary specialties, most of them, they go to vet school, they complete an internship. Now, your internship was a rotating small animal internship.
That's correct.
At the University of Georgia, you rotated through all the departments to a certain degree in small animal. Just got lots of exposure. So you were at Georgia, what year? 2014?
That would have been 2014. I graduated in 2013.
Okay.
Georgia 2014 and then...
Okay. So Dr. Bargis wasn't there yet. He was still at UT. Yeah, he's there now. I have some people that were at Georgia then. We probably know some of the people from Georgia. So most specialties do an internship. I think the exceptions are like pathology, maybe one or two more.
Yes. ClinPath.
Yeah. Some of the less like clinic, like with clients.
Yeah.
Okay. So 1 year of rotating small animal internship, and then you apply for residencies. So when did you decide you wanted to be an ophthalmologist?
I actually went through vet school thinking I was going to be an equine practitioner.
Samesies.
Yeah. So I had Dr. John Foreman, who's the associate dean, one of the associate deans at the University of Illinois, took me under his wing my first year of vet school at Illinois.
He's an equine vet.
He's an equine internal medicine specialist.
Yeah, I probably should know his name, but sorry.
And he took me under his wing. I started doing summer research with him. Okay. Summer carried into the school year. I was big into equine at that point. I thought I want to be an equine surgeon. So everything was equine. I got into my 4th year of vet school and started traveling to all of these equine specialty practices. And there was just a part of me, I didn't grow up with horses, and I wanted to, be an equine practitioner, but there was part of me that just said, I don't want to lose the dog and cat aspect of it.
Mm-hmm.
And I had Dr. Ralph Hamer and Amber LaBelle both come to me and express that they felt like I showed strong qualities for ophthalmology and that would maybe give me the best of both worlds. So I pivoted very quickly my 4th year and decided I was going to go into ophthalmology because I could see horses and I could see dogs and cats and lizards and elephants and all the things.
Yeah.
And it worked.
Yeah.
I got very fortunate. I matched at Georgia. And then nowadays it's very uncommon to go straight from a rotating internship into a residency just because there's such a high demand for the residencies. And I was fortunate enough to go from Georgia to Purdue.
Yeah.
And now here we are. So
yeah. So cool. You know that we talked about that, so I also wanted to be an equine surgeon, but I also had I loved ophthalmology, and it was like, I'm either going to apply for equine surgery residencies or ophtho residencies. Mm-hmm. But have we talked about how my ophtho rotation in clinics was the only rotation I didn't get an A in?
You're kidding.
No, I will not name names, but because this person is a wonderful ophthalmologist, but this person is known for not giving any students A's. It doesn't happen.
Okay.
And that was my clinician on ophtho. And I was all geared up to go do ophtho. I did my rotation. I worked so hard and so hard. And I did it. And I was like, okay, yes, I could totally see myself doing a residency in ophthalmology.
Yeah.
And I thought, she and we had great rapport, and I thought, I just gave it away, but I thought it was great. And so I got my grade, and I was like, it was a B+, and a total
Which if they don't give A's, B+ is as good as it gets.
They did tell me that was their version of an A, but it was just so funny because I was such a Karen of a student. I sent an email can I just get an explanation for why? Yeah. But anyway, that's my funny ophtho story. But I was fascinated with it, and I thought the same thing. It's so cool that ophthalmologists get to treat one part of, and they can do that in so many species. And so and the eye is just so cool.
It's an amazing specialty. It's an amazing organ. You can take an eye that is in a really, really bad place, whether it's a bad injury or it's blind, and you can fix it. You can make the pain go away. You can make them see again. And we get to do that day after day. Yeah. And it's, we had a lizard recently, a leopard gecko that came from a horrible housing situation, couldn't see for a period of time, ended up unfortunately losing an eye, but now can see again. We're about to offer cataract surgery to an owl or a hawk that we will get to release back to the wild after surgery because it can see again.
You better get lots of content from that.
So yeah, we hope to.
That's so cool.
So yeah, no one day is the same.
And eyes are very important to clients,
mm-hmm.
To pet owners.
Yeah.
There's I don't know. It's eyes or something when if we in GP, at least if we have to talk to a client about potential enucleation or just removing the eye or the possibility of that happening, it's very emotional for clients. Mm-hmm. There's something, I don't know, ethereal about eyes, which just makes it even cooler. And they are so important, but it is fascinating. I could just nerd out explaining about how the eye works mm-hmm. to clients. Mm-hmm. So I'm sure you're the same because you're an ophthalmologist. Yeah. So you get to nerd out about eyes all day, every day, which is really fun. So ophthalmology residencies, they're 3 years. So you went.
Most are 3 years. Some are now 4 years.
Oh, I didn't know that.
Yeah. So UC Davis, I believe, is now 4 years. Florida is 4 years. And a lot of times what they'll do is the first year that you come in, you're also completing a master's at the same time, which I did at Purdue as well. I got my master's and my residency, my board certification at the same time. But the 4-year programs give you 1 year to focus on your clinical research. And then the rest is...
Yeah. Oh, I did not know that. Okay. Mm-hmm. So residency, and you did that Tell us where you did that.
Purdue
At Purdue,
University.
yes, right, Purdue.
Indiana.
Yes, Indiana. And then came to Nashville in 2017. When did you and Tara get married?
We got married in 2016.
Oh, in the last, right
I
there at
spent
the
half
end.
of my residency check and what I made in 1 year as a resident, which is not a lot,
Having a wedding.
on the ring.
Oh, on the ring. Oh, okay.
Yeah.
Oh, well, yeah. Well, I mean, I know what residents make, so I don't know. Has she gotten a ring upgrade since then?
No.
No, I'm just kidding. I'm sure it's beautiful. Okay, so you got married, you came to Nashville, you worked as an ophthalmologist here and got lots of experience. And most ophthalmologists, okay, so they do 3 or 4 years residency and then they go into practice. And there are ophthalmology practices in most big cities are going to have at least an ophthalmologist in a specialty group, but there's a lot of standalone ophthalmology practices.
There are. It is great being part of a multi-specialty group just because you can bounce things off of each other.
Yeah.
We need cardiology, we need dermatology, we need neurology. But because our service is so vastly different than so many others, we're very fast paced. It only takes a couple of minutes to do our exam, if that. The majority of the time is spent talking with clients, but we will see 20, 30 plus clients a day. And it's not that we're just trying to get through as many as we can. It's just, it's a fast paced service. And so it can be difficult for us to be a part of those multi-specialty hospitals just because of the sheer volume of people that come to see us. So I think we are starting to see more and more singular private practitioners go off on their own, or just groups step outside of the multi-specialty hospitals because the service is different.
Yeah. And are all of your most optho or any specialty client, they're going to be referred to you from a general practitioner? Do they have to be referred to you from a GP vet?
They do not. And we prefer a referral. However, we also understand that there are, certain instances where maybe a client, a pet owner can't get a referral.
Yeah.
And they're seeking a second opinion because, maybe something's not going well. And it's hard for me to just say no to something like that when the overarching goal is just to ensure that we're providing the best care for our patients. So
because there's no oversight. There's no rule. That's like an unwritten thought, which obviously everyone in vet med knows that a referral is best, but it's good, I think, for people to know that, or, that they can get right in, because also in some areas of the country, it's really hard to get into a GP vet urgently. And so they're stuck with, they can't wait for 3 weeks. And sometimes going to an ER doesn't get just super far with ophthalmology. And so it's nice that they can go straight there. So tell us so you see all different kinds of animals. I'm assuming mostly dogs and cats. I mean, I know that. But you will see anything, right? Basically, that's is safe to see or you can get to. And let's talk about dogs and cats first. So what would you say is your most common, let's talk about dogs. In dogs, what's the most common thing that your practice treats?
Most common, I would say, is probably cataract treatment, which treatment for cataracts, there's a bit of a misunderstanding. I think just information on the internet that certain medications, certain eye drops can take care of cataracts. And that's not true. The way that I try to explain that to owners is it's like cooking an egg. Once it's cooked and you've changed the proteins in that egg, there's no way of going backwards. So the only way to address those is with surgery. So cataract surgery is probably the most common procedure that we offer and we perform. Second to that, I would say it's trauma to the eye that we're fixing or correcting or medically managing, or eyelid issues. So birth defects or something that has happened because of an inherited condition. Yeah.
And something else people may not realize that you should definitely talk about is how much surgery you get to do in ophthalmology. There's a lot of really cool surgical procedures, which cataract surgery I know is a really big part of it. And there's a lot of a lot of other things, which we'll talk about. So that's dogs. So in cats, what do you see cats for the most?
Far and away, the most common thing we see kitties for is viral disease, which feline herpes virus, presents in a lot of instances as upper respiratory disease, but in our world as squinting, as tearing, as redness, and corneal ulcers. So we'll see cats that will come in for various iterations of that, and we're treating them for that.
Yeah. Yeah. And, I think it's important for people to know too that general practice veterinarians, they have education in ophthalmology, and as far as their comfort level and their knowledge about and ability to do some of those smaller procedures there's gonna be a big range.
Yeah.
So some GP vets are gonna offer or recommend referral for most ophthalmology issues, and then some are more comfortable with some more minor procedures. But we refer a lot of ophtho patients. We try to, if owners are willing and able to do that. A lot of, I would say on the GP side, which I think is good, is a lot of our patients, we are trying to treat something, we hit a roadblock, especially in cats, because, I think GPs sometimes are like, oh, there's like 2 things I can do in a cat that has an eye problem, and I need an ophthalmologist to help me with that. And it's nice when owners are willing to just go sooner. And that's another thing I think is important for pet owners to know, regardless of what their GP may tell them, is that it's never wrong to go to a specialist.
Yep.
And in a lot of cases, it's better to go sooner than later. And I know that your specialty feels that.
Yeah, and I have a couple of things to say on that. First, we pride ourselves. Our practice is there when you need us, whether it's there to send a physical referral to us, or if you have a question, you send us a text, you call us. Myself or the other 3 doctors that we have are more than happy and more than willing to help you get to the point of, okay, I can't do this anymore. Now you need to go see them in person. Because so we work for you guys. We are there for you guys. And I think that's so important. And I think it's also important for owners to know that, if your vet is willing to speak with us and help get them to a point of, it's fixed, or we've done all we can do here. Now it's appropriate for you to go. We've exhausted what we can do here.
Yeah.
And then the other part is, and we were talking about this the other day, the Collaborative Care Coalition actually looked at, I think they polled 890 people and found that one of the top 3 drivers for advocacy, so for a client to say, you need to go to Beecham, you need to go see Dr. Molly, was because of your willingness to communicate with specialists. So giving them the confidence that, okay, I know that if I go and see her, I know I'm getting the best care, because collaborative medicine is the best medicine.
Yeah. Oh, for sure. And, being a medical practitioner, you never want any kind of like pride to get in the way of, it's never, I think sometimes there's this misconception that, like, I don't know, it's like a weakness, like, oh, now I gotta refer because I can't figure it out. And like, that's people should just let that go, because it shouldn't feel that way. It should be like, I need a specialist's help, and we are going to figure this out together.
Yeah.
And you're right. If pet owners feel also a part of that equation and that access, it should be, a triangle where all 3 of us are working together. Like you said, they feel so involved, and then they're more inclined to say, okay, yeah, I agree. It's time that we go see the eye vets now.
Yeah.
And if we all worked that way, I think, well, that coalition study proves it, that outcomes are better and everyone's happier and pets get better care. So I am excited that you bring that up, because it's been so cool to watch the eye vets, because you like did the dang thing. You went out and started this on your own, and it's been how many years? 2 years?
Not quite a year and a half.
A year
October
and a half.
2023. Yeah.
Yeah, a year and a half. And in that time, how many ophthalmologists are at the main practice now?
So it's myself and 2 others full time, and then we have one other who is part time.
Yeah.
And
so 3.5 vets.
Yeah.
And lots of really great support staff.
Our support staff, I mean, maybe we can duke it out, but we might have the best that exists.
You have a great team.
It's unreal.
Yeah.
I'm so proud of the team that we have.
I just want to come hang out at the iVets sometimes. I'm like, oh, it's my day off. I should go see what they're doing and say hi. Yeah, no, everybody's so great. And you finally had an open house for the practice.
We did.
Because you started. So let's talk about let's talk about the building.
Okay.
So you bought a building.
It was 2 buildings. And one of the buildings was a previous vet practice that had recently closed. The other building was a dog groomer and a dry cleaner. And the objective was get open, start, generating some revenue, and then ultimately build out the other space. So we opened in October of 2023 in the old vet practice, and started growing, started building our caseload, and then all the while started designing and building the space next door. And after 5-6 months of designing and building, which had happened very, very quickly, in August of 2024, we moved into our new building, which I'm elated with. I'm so proud of. And
it's
Tara,
the coolest.
my wife,
it's Tara. It's
deserves
so cool.
the majority of the credit for the special tweaks. We did work with a group called Design Build Partners here in town.
Yeah.
Who are amazing. And I'm so grateful for them. But my wife did a lot of really cool things.
Yeah, like special, there's custom wallpaper, right, in the rooms? Is it your logo? I can't remember.
It's our logo. It's subtle.
Yeah.
But it's just
so cool.
My goal with all of this was to create a feeling and a brand and not just another place that you take your pet to. And so we tried to keep that in mind as we did everything with the space. And I also wanted a space that our staff was proud to come to and they wanted to come to every day. And, I think for the most part, we've achieved that. So
yes, I would agree wholeheartedly. We started sending clients to you, immediately when pretty much when you opened. And we just get the clients that go, they just come back and they're like, oh my gosh, they're amazing. They're so great. And then now they're like, and it's so beautiful. It's just like a bonus. So we love sending clients to your practice, and that's how it should be. No matter what it looks like, that's just a bonus, but it feels good to them and they feel heard. They definitely, I definitely see the difference in clients who have gone to a specialty practice that is collaborative with us. They feel that. They communicate that. They don't always know that that's what they're feeling, but I know that that's a lot of why they're so happy. And you all are so great about, you're in touch with us, you're in touch with the client, and you're available, like you said. Availability, especially in a specialty where there are really urgent things, is really important. And y'all do that. And so it's very exciting. And we feel very lucky to have you 20 minutes down the road. So we're excited about it. And you're expanding and trying to reach people in other places. And I'm sure that will just continue to grow. So it's very exciting.
Yeah. And telemedicine, which, has kind of been a hot buzzword in veterinary medicine over the past several years, is a big part of our practice. And again, it's just meant to make things easier for people. So if they can't always get to us, we still want to be able to help.
Yeah, so let's talk about how that works. So telemedicine is a little different in every state.
It is.
Broad veterinary profession right now. States have different laws about what a vet can do over the phone, who they can actually recommend something to, can they prescribe medication. So in your practice, telemedicine, does it mostly or only exist for clients you've already seen? Yeah, so that's because of the state we live in, right? Tennessee,
Right, so we have to have the established VCPR, vet-client-patient relationship. So we need to have seen a client to make medication recommendations
Yeah.
by phone. There is kind of a loophole caveat, though, that I can work with you to make recommendations for your client. You are the prescribing doctor for a lot of these situations,
Right.
for most of those situations, but telemedicine can exist in that way as well.
Yeah.
So.
Yeah. And it totally should, especially for clients that we've seen and we know what's going on. And especially in this day and age where practices are so busy and there's so many patients to see.
Mm-hmm.
And sometimes that allows a space for a patient that needs to be seen in person, which is so important. So I also want to, and it feels a little silly to talk about a couple of these things because we and anyone in vet med knows these things, but lots of pet owners have never been to a specialty practice that's outside of their GP. And so I kind of want to talk about what it looks like when a client comes to your office specifically. So on our end, GP end, we see a patient, we identify they need to go to an ophthalmologist. I will have probably talked to you or somebody in your practice. We send records to you all. We let you know and then tell you they need to come, and then you tell us what happens after that.
Let's dive into details a little bit more. Yeah. And let's say it's a diabetic patient.
Okay.
Because I think it's important to communicate on the back and forth that we have, because so much of their care is your job.
Yeah.
And we are there for a small part of it. So let's say you've sent us a diabetic patient because 60+%, 80+% of diabetic dogs, develop cataracts.
Yeah.
And they will suddenly lose vision. So they come to see us, similar to how I imagine it happens at your office. We have an exam, we have a waiting area, we have an exam room, a history is taken by one of our support staff. I go into the room and then perform the eye exam, which is going to feel much faster than probably what your exams feel like because we're here.
Mm-hmm.
And so we assess vision, we assess their ability to interpret light, and then we look at the eye from the front to the back. So we have different instrumentation that allows us to do that, greater magnification so we can pick up on minute details. And then in instances like diabetic patients that have cataracts, because we can't see the back of the eye, we offer additional testing to see, are they a candidate for cataract surgery? Are they going to be able to see if we take these cataracts out? And then if they are, great, we can get them scheduled for surgery. And it's an amazing procedure. We remove the cataracts, we restore vision. It's like that. It's like magic. It's
so
incredible.
Cool.
But then it's a back and forth between us, because so much of that is, how are they doing with their diabetes regulation? We don't want them to get sick, to develop pancreatitis, one of these coexisting issues that can happen. And so, the communication between us has to be really strong.
Yeah. 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 So you and I have been in the practice. It's so nice, but there's lots of exam rooms. So clients go in an exam room with their pet. Y'all are going to do the exam in there. And I think it's important for people to also, sometimes people ask me like, well, what can an ophthalmologist do? What do they have? What do they do that you can't do? And I think I'm like, oh, a lot. And they have a lot of things that I don't have. So the diagnostic equipment for ophthalmology and GP is pretty minimal.
Mm-hmm.
I mean, we can look in the eye and we can measure pressure of the eye and we can measure tear production and check for stain uptake.
Mm-hmm.
And that's kind of the end of what we do diagnostic wise. Yeah. But if you maybe just kind of want to talk about a couple more of your more specialty diagnostics.
Yeah. So we have, if you've ever been to a human ophthalmologist and they've looked at you, they have their table mounted slit lamps, which they use to look inside of your eye. Well, our patients won't sit still enough. The table-mounted slit lamp. So we have an instrument that allows us, it's mobile, that allows us to do the same thing. So we have a mobile slit lamp that allows us to look at the front of the eye. And then to look at the back of the eye, we put a big fancy headset on, we use our lenses, and we're able to visualize the beautiful retina and the optic nerve. And then, taking it beyond that, diagnostic wise, like I said, we can ultrasound the eye, which some general practitioners will do.
Mm-hmm.
And we can also assess vision. We can assess responses to certain colors of light. And then, which we don't do a lot of, but you can refract animals and you can try to determine what correction would be should we decide to correct them with corrective glasses, lenses, which I think is probably one of the biggest questions that we get. And I think most of the time it's a joke. Like, you're an eye doctor for animals. Do you put glasses on them? We could.
Yeah, you're like, I could.
Do you think your dog will wear one?
Yeah.
Wear them?
Yeah. No.
So yeah, it's more specialized equipment to be able to gain a better understanding of what's going on.
Yeah, and it's all very cool.
It's very cool.
So cataracts are the most common thing you treat surgically, at least in dogs. So why don't you walk us through cataracts, or maybe cataracts and cataract surgery, because it's very cool.
It's so cool.
Yeah.
It's my favorite. It's still my favorite. So start at the cataract evaluation or go straight to surgery? Let's talk through surgery.
So first let's talk about cataracts, because just as pet owners looking at the eye, it's one of the most common things people be like, I think Bella has cataracts because her eyes are looking cloudy. And so cataracts happen, and that could be cataracts. There's a lot of things that that could look like cataracts to a pet owner. Maybe like they think some haziness could be cataracts. So tell us what a cataract is and where it is and how we know that it's cataracts.
So a cataract is an opacification of the clear lens, which is the structure inside of the eye that sits directly behind the pupil.
We'll show a picture.
Normally, excellent.
Yeah.
Normally, it's supposed to be crystal clear, so we can have fantastic vision. But anytime there is any sort of deviation from perfect clarity, the true complete opacification would be considered the cataract. The lens proteins have changed.
Yeah.
There's also, which a lot of clients will come in thinking their pets have cataracts, and they have what's called lenticular or nuclear sclerosis, which is a normal age-related hardening of the lens. A little bit different than cataract in that we can still see through the lens with nuclear sclerosis, especially in the earliest stages. As it becomes more dense, it's not quite as clear. But with a cataract, it's a complete obstruction. Now, cataracts can be small, and when you come to see us, and if they're small, it may not be time for cataract surgery. But as they continue to get larger and it starts to truly impact their ability to see, they're cautious going down steps. They are bumping into things. You throw them a treat and they can't catch it quite as well. That's when, it's time to start talking about surgery.
Yeah. And maybe also tell the people what happens because we're going to talk about how you treat them. But if you don't treat cataracts, tell us what eventually can happen.
So what eventually can happen is that the animal can go completely blind.
Yeah.
And there's a lot of thought out there that, well, my dog went blind and they can do fine. They can smell, they can hear. And that's true. A lot of dogs are incredibly resilient, much more resilient than we would be. But I have this, internal theme of blind dogs do okay, sighted dogs do a lot better.
Yeah.
And I truly believe that. So beyond just the blindness, what we can see, especially in diabetic patients, for instance, is inflammation can develop within the eye. Inflammation is painful. And then if the inflammation goes untreated and is too severe, they can develop glaucoma. Glaucoma is high pressure in the eye. And anytime the pressure starts to go up, that can also be very painful, and that can be blinding. And if we miss our window, sometimes even taking the cataract out afterwards, if they've suffered severe inflammation or glaucoma, vision can't be restored.
And it's too late. So then you have a painful eye that doesn't see. And so a lot of times enucleation or removing the eye is what's recommended.
That's right.
So that's why it's a big deal. And that's why it's something we always, in general practice at least, we always want to catch cataracts. We always want to see them. It's why we look in the eye when we examine a patient. And it's why we want to get at least a consultation with an ophthalmologist when we can, so that you all can determine, okay, it's probably time to consider surgery, or maybe we can monitor this very tiny little bit of a cataract. And I think, and I want you to talk about it, but that's a mindset that's changed, I feel like, in like general GP vet med over the years, that vets used to wait longer to recommend referral and consider surgery, and we're doing that sooner now. Yeah.
Absolutely. I'm honestly so impressed with the shift that has happened. We will see a lot of dogs that come in with early nuclear sclerosis or pinpoint tiny cataracts that are not yet impacting vision, or a dog that's newly diagnosed with diabetes that hasn't started to develop cataracts, but they've come to see us to establish that relationship. That's amazing.
Yeah.
And then we're able to track those animals as they move along. We can get them started on anti-inflammatory drops so they don't develop that inflammation. We can monitor their pressures. If they've driven a great distance to come and see us, well, at least we have a baseline.
Yeah.
And now we can work with their primary care veterinarian to say, okay, this is where they were when they came to see us. And now these are the things that you need to watch for until it progresses to a point where they need to come back and see us.
Yeah. Yeah. So once a patient's cataracts progress to the point where surgery is recommended, tell us how the surgery works, because it is very cool. I got to watch some cataract surgery in vet school. And
you need to come over.
I need to just come watch because I loved it. So yes, walk us through it.
So cataract surgery is completed very similar to how it's done in people. We have to tweak it because a dog is not a human. And in human medicine, a lot of times you'll receive mild sedation or you'll be awake for the procedure, which I can't imagine.
Yeah.
But in our canine and sometimes feline and sometimes avian species, we need general anesthesia. So they come in for surgery. In our hands, surgery is an outpatient procedure. They go home the same day. So they're placed under general anesthesia. We make a tiny little incision in the eye. We enter the eye. The lens is held inside of a bag, a capsule. We tear a hole in the capsule, break up, vacuum out the cataract. And that's kind of the amazing moment when you can finally see the back of the eye.
Is that your favorite part?
Yeah, I think so.
Vacuuming out.
Vacuuming it out. It's either that or it's seeing them back at 24 hours when they're wide-eyed and they're like, what is this place? I've never seen you before, even though I've been here before. So it's the cataracts removed, and then we replace it with an artificial lens. And the lens, we have a lot of questions. Why do they need a lens? What happens if you don't get a lens? And the lens is necessary because it allows us to see things up close to our face. If no lens is placed, then they become farsighted in that eye. So it's always our goal to place a lens.
Yeah.
And then they go home. It's an intense 2 weeks after surgery, making sure that the eyes stay healthy. They're on a number of eye medications and they're in a cone.
Yeah.
And the cone is the worst part of it.
Make them wear the cone.
Make them wear the cone.
Yes.
That is.
Just wear the cone.
And the hard plastic ones, not the donuts.
A real cone.
Not the soft.
Mm-hmm. Mm-hmm.
The hard plastic, traditional Elizabethan color.
Yes. Yeah. The satellite dish.
Yeah.
The cone of shame.
Yeah.
Yes. Okay. Wear the cone. And then they follow up with you how long after surgery? After the first 24 hours?
So we see them at 24 hours. I see them at 1 week and I see them at 2 weeks. And then I start to space it out from there. And I really like to see my patients back long term, every 6 months to a year, just because dogs, again, unlike us, if something's going wrong, if there's a little agitation, they're not going to let us know until it's bad.
Yeah.
And if they've lost vision in an eye, I can't tell you how many times we've had animals come back that they have lost vision in an eye and the owners had no idea because they did fine with the other eye that also had surgery. So allowing us to continually check in is so important.
So we talked kind of about dogs, but you said you do this sometimes in cats. What other animals have you done cataract surgery? Who else gets cataracts?
Well, all species can get cataracts. I've only done a dog and a cat, numerous. But I'm about to have this hawk come in for surgery, which we're having a custom-made lens created for it with Vision. But elephants and tigers and sea lions and fish.
So it happens at zoos, right?
It does.
In the big animals.
It does.
Oh, that's so cool.
It's amazing.
I need to come watch some cataract surgery.
Horses. I take that back. In my residency, I was a part of.
Oh, okay.
I was a part of equine cataract surgery, which that's a whole separate beast.
Do you see horses now very much?
I saw a lot of horses when I first started in private practice. And then my small animal schedule just got so busy that it was hard to step away from the practice to go out and see horses.
But there's some in the area that there's an ophthalmologist that visits sometimes, right, to see horses in the area. And
that's right.
Yeah. So cataracts, it's a big deal. So take home points for pet owners for cataracts is well, on my end, I always say, make sure, when your vet's doing an exam, they're looking in your pet's eyes. That's really important. And if you suspect there's some kind of vision change or you're noticing cloudiness, it's totally fine to just say, hey, it seems like their eyes are cloudy. And if it's nuclear sclerosis, great. That's great news.
No problem.
But we should always check. And most of the time, the earlier you can go for a consult with an ophthalmologist, the better. And early surgery is better than waiting for it to get really bad.
Yeah. And I wouldn't expect a pet owner to try to decide, is that nuclear sclerosis? Is that cataract? If the eye's cloudy, the eye's not supposed to be cloudy.
Yeah.
And so talk with your primary care vet about what do they think is making it cloudy, and if it warrants coming to see us or an ophthalmologist, great. Come on and see us.
And something too, I see, and you see all the time, I'm sure, is dogs who have vision change can be hard to know. Like you just said, sometimes people have no idea. But even if both eyes are affected, dogs adapt so well to their environment. And some people don't realize their dog is having issue with vision until maybe they move or they move their furniture. And all of a sudden their dog's environment has changed that they had learned, and they start running into things. And so any kind of change like that is important. And you can always go see an ophthalmologist. And best case scenario, they say everything looks okay.
Yeah. I mean, I'd love to give news that everything looks totally normal.
Yeah. Okay, so let's do some fun questions about your job as an ophthalmologist. What is your favorite species animal you've ever worked on?
I don't know if I've told you this. I am very fortunate. I get to work with the Elephant Sanctuary in Hohenwald, Tennessee.
You do?
I do.
Does Dr. Scott still work there?
I don't believe so.
He retired.
I don't believe so.
He was one of my vet school interviewers. But he was, and I was like, oh, Dr. Scott, you work with the elephants. So how often do you go there?
Right now, it's kind of been like once a year.
Okay.
I think they get really busy with their schedules, and the Elephant Sanctuary in Hohenwald is just truly one of the most amazing places. What they do for those animals is unreal.
Yeah.
But I get to go in and perform eye exams on, and these are all geriatric, elderly, most of them elderly animals that have come from situations that they either couldn't keep the elephants anymore, or they were in bad situations and they were trying to get them out of it. So,
and there's several, right?
I think they have 12 right now. Yeah. So
most people don't know that, and that's because the sanctuary it's
close to the public. So that's why I am also very grateful for the opportunity. I am thrilled.
I'm not allowed there. That's so awesome.
Yeah, I think they told me once that the only outsider that was able to come in was David Attenborough, who is the voice behind Planet Earth.
No way.
And otherwise it's just because for the protection of the animals.
Yeah. I mean, they do it the right way. That's how it should be.
They do. Yeah.
I definitely want to sneak in sometime. Yeah. Oh, that's so cool. I didn't know that. Oh, yeah. Elephants are so cool. Oh, okay. And, I have another question. This has nothing to do with ophthalmology, but I don't want to forget to ask you this question because I'm asking every guest this question.
Yes.
Because we're going to wrap up. Do you know what dog breed you would be if you were a dog? Because you are quiet to a certain degree, very even keel and calm, but very kind and thoughtful. Maybe. What do you think about a greyhound?
Honestly, that was something that I was
thinking greyhound?
I was thinking greyhound.
Okay, greyhound.
I think a greyhound.
I would totally go see a greyhound as an ophthalmologist.
I love a greyhound. They're lazy dogs, though, right? Like you take them off the racetrack.
Well, okay. They like to nap, but they can run.
They can run.
Yes.
They're very, very fast.
They are
athletic.
athletes.
Maybe that's fitting. But yeah, maybe that's
we're going to go with greyhound.
Okay, I'll go greyhound.
And you can think about it and change your mind, but we're going to go with greyhound.
Right.
Okay, so we're going to wrap up, but I do want to make sure everyone that's listening knows where they can find you and where the iVets is. So the iVets is your practice. It's here in Nashville. And I know this, but I want you to tell us. It's very exciting that you're doing what you're doing at the IVETS. You've gone out on your own. You have broken some molds, what people in vet med and out of vet med think about specialty veterinary practice, which I think is important. And we need that. Every profession needs people to do that. Otherwise, things will just be stagnant and go downhill. And so I just would love for you, we talked about it a little bit, but like, what do you think sets the IVETS apart from your average specialty or any veterinary practice?
Well, I certainly don't want to say anything we've done is unique. But the things that I am most proud of is our ability. We have set communication with primary care veterinarians and our pet owners as our top priority, because when you start to lose track of certain things because you're poorly communicating, that's when medicine starts to fail. That's when people start to get upset. And so we've made ourselves very, very available to as many people as we can, just because we don't want there to ever feel like there's a gap. So our communication, number one. And then I think we are constantly trying to figure out what we can do to stay ahead of the curve. What treatment modalities can we offer? What surgical techniques can we offer? And that's been a huge part of our practice as well. And then what you mentioned previously, spreading out. I think that's probably pretty unique.
Yeah.
I think a lot of people look at us and go, "You opened in October of 2023 and you have 5 locations," which I think it looks a lot bigger than it is. It's not that we have 5 locations. It's just that we have spread out so we can make getting to us easier. We don't own those facilities. We're there.
Yeah. Yeah.
So.
Yeah. And people can go and know that they're going to be taken care of and that you're going to be communicating with their GP and relaying everything back. It is a cool thing in vet med in general that is different from human med in so many ways, because in the ideal vet med situation, there is so much communication that happens between the primary care provider.
Yeah.
The piece, I mean, that's what it is, the GP and the specialist. And there's no lapse in, everybody knows who's on first. Like, everybody knows what has been done, hopefully, when this axis is healthy.
Yeah.
And like we said, people feel that, all 3 parties that are involved. So, well, I am just excited to see what happens next with the IVETS, where you go next and what you do. And everybody at our practice is really glad to have you. How can people find you?
They can find us at our website, which is theivets.com.
Yes.
We are also on social media at the IVETS on Instagram and Facebook. And I have a LinkedIn profile, but I don't know if that's as exciting.
For some people, I just am not into the LinkedIn thing yet. Yeah. I feel like I should be.
I haven't gotten into.
People like post.
The TikTok.
Oh, the TikTok. Yeah, TikTok's a weird place. It's where I started, so I feel loyal to TikTok, but
yeah, that's good.
It's a weird place. But LinkedIn, I don't understand how it works. People like post on LinkedIn and like comment.
Yeah.
And I didn't really know that until like a year ago.
I'm actually a big fan of it now. It's becoming a much bigger deal.
Yeah, see, I apparently I need to join the party. Okay, so www.theivets.com, Instagram
at the IVETS.
At the IVETS.
And
yes.
Facebook.
And Facebook.
At the IVETS.
Okay. And if you look, they recently did a post showing lots of pretty awesome, beautiful things about what the practice is.
Yeah,
like.
Our social media, it's meant to be fun showcase. It's supposed to be for pet owners and primary care veterinarians to provide information, but then also, throw in some of the fun design things that we've done. And so, yeah, follow us.
Yeah. Okay. Well, thank you for being here with us. One of our first guests. So guinea pig guest. I didn't have, so funny story. I'm like, yeah, Ben, come be on my podcast. You'll be one of the first interviews. And we show up, we're in the barn, my parents' barn. And I realized, oh, I was supposed to order a second microphone for my guests. And we were like, oh, crap. But we figured it out, and here we are. Okay, this has been another episode of the Dr. Molly Says podcast. Thank you for listening. You can catch clips of this episode on our Instagram at the Dr. Molly Says pod. You can also listen to this on the podcast provider of your choice. Be sure to download and follow us. And if you would like to submit a question for my solo episodes, you can do that by DMing us on our Instagram or follow the link to submit those. Thanks.